Hi, so I'm Erin Lofties, and this is Dr. Littlebear with me today. We're going to be talking about narcissistic abuse, so differentiating between the fact and fiction. There is a lot of buzz around this concept of narcissistic abuse right now. It's kind of a buzzword in the pop psychology realm, but we're going to work today to kind of comb through some of the research and sort out what is commonly understood about narcissistic abuse versus what the research actually says.
Thank you, Erin. Like Erin mentioned, I'm Dr. Littlebear, and we are from the University of Cumberland, and I am a core faculty member there, and Erin is one of our amazing doctoral students. Let's see if I can. All right. You got it. Okay. So when we talk about narcissistic personality disorder, and we go to our DSM-5, and we understand that there are various symptoms or ways that people present with narcissistic personality disorder. So it's that grandiosity and arrogance that we think of, maybe having these fantasies of extreme success, wealth, and beauty. Maybe even that belief that one is unique and special and can only connect with other special people. Admiration, entitlement. We might see that lack of empathy, maybe even some exploitation of others, and that preoccupation with envy and wanting what other people have. Unfortunately, narcissistic personality disorder is one of the hardest personality patterns to treat. It's not very well understood, and the prevalence of this disorder, based on the DSM-4, is about 0 to 6.2%, with 50 to 75% of those being male. So a good portion of people we see diagnosed with this being male. What are some traits? So if we think about personality traits associated with narcissism, when we think of grandiose narcissism, it's more associated with things like dominance, that grandiosity, entitlement, and even aggression. So is this possibly where some of the beliefs that abuse comes out of narcissism come from? It's a possibility. Also, extroversion and disagreeableness are associated personality traits. So if we're looking at, like the big five or whatnot, these are some of those traits associated. But on the other hand, vulnerable narcissism looks more like fragility and defensiveness that looks a bit more vulnerable. And there's high levels of neuroticism associated with this vulnerability, along with low agreeableness and lower extroversion. So it looks a bit different than that grandiose narcissism that we typically may associate more with narcissistic personality disorder. So, the research is showing that narcissism might not look like what we think narcissism looks like.
So, one of the interesting things about narcissism, which Dr. Littlebear just touched on, is that there are possibly multiple types of narcissism, and we haven't really been able to agree as a mental health community on the different types and what that looks like. So there are a lot of different proposed models of breaking down NPD into subtypes. So one of the proposed set of categories are Mylan subtypes. So he has the elitist narcissist, and that's, again, kind of closer to probably the popular conception of somebody who is very eager to tell you about all the wonderful things that they have done, how successful they are, how smart, how likable, how, connected, all the things that they've done. Then there's the amorous narcissist. So somebody who wants to prove themselves to the world through sexual conquest, showing the world how many lovers they've had, how they are irresistible to other people. But very rarely are they actually making any kind of emotional connections with people. Then there's the compensatory narcissist in this model, and that's someone who actually is aware of some emptiness inside. They realize that there's something missing, and they're trying to find a way around that. And so there is a sense of shame and anxiety while they're trying to create this illusion of superiority for the rest of the world. So you can imagine how fragile a person like this might be, because they realize that there is something going on, that they're missing something, or maybe they don't have the connections or the emotional experiences that other people have, but they want people to believe that they're very happy, that they're successful, comfortable, etc. The last one is the unprincipled narcissist, and this is another one that is probably pretty well connected in the common perception of narcissism. Somebody that you might see in a movie being labeled as a narcissist. So this is somebody who has the narcissistic traits combined with the antisocial personality traits. An example of this would be Ted Bundy. Ted Bundy is sometimes characterized as an unprincipled narcissist. So he was somebody who put on this air of being very successful and intelligent. He wanted people to think that he was well educated, well connected, but at the same time, he had no empathy and really no regard for social norms and morals. The term narcissistic rage is another thing that you may see in articles that's kind of come out into the popular vernacular. And that was a term coined by Kohut, and that's referring to when a person who has narcissistic personality disorder or has deep narcissistic traits finds a clash between how they perceive things or how they want people to perceive them versus realizing that maybe other people don't see them that way. So there's this conflict between, I want to be successful, I am successful, other people respect me, and somebody comes back and says no, or I don't view you the way you want me to view you or the way you view yourself, resulting in shame, anger, and resentment, and in some cases, violence. So sometimes in popular articles and occasionally in journal articles, you'll see someone try to connect narcissistic rage with a violent crime.
All right. So the malignant narcissist. This was a term coined by Fromm, and Kernberg elaborated on this phrase or on this terminology. So we have 4 features that are found in this malignant narcissist, and I'll go into this a little bit later as well. But there's that core narcissistic personality disorder. So that those criteria that I talked about earlier in this presentation are coming out, as well as the antisocial behavior that Erin was discussing. So again, it's that person who wants to feel really good, yet their relationships are not exactly, very sincere and genuine. This egocentric sadism, just totally, very just their ego needing something that maybe we can't explain very well. And then this paranoia that's going on as well, like, always looking over their shoulder, not being very trustworthy at the same time. We look at covert versus overt narcissism. So overt narcissism is probably classically what we would think about narcissistic persons coming across as, that outwardly boastful, self-aggrandizing, maybe bragging about themselves a little bit. And that is most closely associated with NPD, right? Because that's like, we had a client present That might be what we'd say, oh, narcissistic personality disorder. Covert narcissism might be a little bit more difficult to recognize. It's this amoral quality. It's more like that under the radar insecurity, self-blame, and more fearful, right? So they're still very much about themselves, but it's not the grandiose look that we get from this more overt narcissism that's going on.
So part of what sparked this presentation and our ongoing research was the proliferation in media and in popular psychology. So even things that you might see on websites to educate the public and to educate even mental health workers about domestic violence, intimate partner violence, and dysfunctional families uses this term narcissism or narcissistic abuse, narcissistic relationships. And in my own work with DV and IPV, that's domestic violence and intimate partner violence survivors, I kept hearing, I think my ex was a narcissist. My ex was a narcissist. My girlfriend might be a narcissist. Even I think my mom or my dad was a narcissist. So I just started hearing this explosion of the use of this term narcissist. And when I started looking through various sites just to see, where people were getting this from, I found support sites, I found groups on Facebook, I found tons and tons and tons of books and articles everywhere you can think of. And even in fictional media, you may have seen the movie Joker that came out a couple of years ago. In the movie, they tell him that his mother was a narcissist. So it's something that has leaked into the popular vernacular and into the popular subconscious. So it's something that is being connected with dysfunctional relationships or abusive relationships, and sometimes with villainy or people that we don't like or that we don't understand. So who are the experts? Who are these people who are writing all of these articles and who are putting all these books out there about how to survive narcissism, how to leave a narcissistic abuser, what narcissists hate, what narcissists look for? Well, there are some articles that are written by professionals in the field, counselors, psychologists, psychiatrists, but the majority of them are not written by people who have done peer-reviewed research of any kind or who are writing based on their clinical experiences. It's largely generated by people who are freelance authors, people who have survived a relationship themselves and are trying to help other people. I've seen several books by life coaches, so people that mean well and are trying to give context to domestic violence experiences or violence in the family, but they're not necessarily people who have any kind of credentials in the mental health field or who have ever actually worked with a person who has narcissistic personality disorder as a client, much less the partner of somebody who was diagnosed with NPD. And yet we can find tons and tons of YouTube videos explaining how to deal with a narcissist, how to get away from a narcissist, how to spot a narcissist. And so I have found that some of this has leaked into domestic violence and intimate partner violence support groups and in education groups that are being led by professionals where they're telling people, oh, it sounds like your partner or your ex was a narcissist, and here's how you deal with that, or here's how you know that you were in a narcissistic relationship. And yet they're referring again back to these books and to these articles that may not necessarily be based in peer-reviewed research. So what is domestic violence and intimate partner violence? How prevalent is it? That was another big red flag for me that made me want to look closer and try to understand this phenomenon of calling it narcissistic abuse or calling abusers narcissists. So as you remember at the beginning of the presentation, Dr. Littlebear pointed out that the prevalence of NPD is not well known, anywhere from, almost 0% to maybe 6%. It's something that we're still trying to figure out as far as how common it is in society. And yet we know that domestic violence and intimate partner violence are incredibly common. We know, depending on the study, that it's anywhere from 1 in 3 to 1 in 4 women will experience domestic violence in their lifetime. So how do we explain that numerical discrepancy? How do we explain how so many people are survivors of DV or IPV, and yet we're saying that it's because of narcissistic personality disorder, which doesn't seem to be that common? So what else do we know about DV and IPV? There's a lot of conflicting information as far as, what an abuser looks like. And we found a study that said that in fact, the majority of men who perpetrated and met criteria or perpetrated domestic violence or intimate partner violence met the criteria not for NPD, but in fact, borderline personality disorder. Another study found a high percentage of women who were in prison for domestic violence actually met criteria for NPD. And yet, in the popular media, we're not typically seeing somebody try to link female abusers with NPD. So that was really interesting. Some studies have found a strong relationship between narcissistic traits, low self-control specifically, and violence. Very few studies have examined any possible link between narcissism and child abuse. So it's possible there's a link, but right now we don't know. There's still a lot that hasn't been examined or studied. In a study of veterans, we did find a relationship between narcissism or NPD, but again, that was among veterans, so one specific population, and that was one study. One of the biggest links that has popped up over and over and over again has actually been between psychopathy as a potential explanation or something that links to intimate partner violence or domestic violence. One of the biggest patterns that was found over and over again were abusers who had psychopathic traits coupled with their own history of being abused as a child. So that may make one more likely to commit domestic violence or violence towards a loved one. And I should clarify now, if there's some confusion, domestic violence is more vague as a term and can be interpreted in different ways depending on the study or the body discussing it. So that may mean violence between family members, whereas intimate partner violence specifically refers to violence happening between people who are dating or who are in a committed relationship. So one of the other things that complicates this is that there are likely multiple types of abusers and abusive relationships. And that was a pretty controversial assertion to make a few years ago, but more and more we are seeing that to be true, that you can't fit all types of abuse under one umbrella. It looks different in different relationships. So there are abusers who are manipulative, abusers who have an explosive temper, but otherwise don't show any coercive control or attempts to manipulate their partners. There are relationships, unfortunately, where both partners are physically violent or manipulative towards each other. So it's difficult to pin down what what the single cause is of domestic violence or IPV when there's different types. What we do know, though, is that it is very common, especially amongst young adults. Again, 1 in 4 women, but then up to 1 in 4 relationships amongst young adults, 18 to 28, have reported violence. And that may be violence towards each other or violence with one partner towards the other partner. But it tends to be more prevalent among young people, which again begs the question, if this is related to narcissistic personality disorder, why are we seeing higher numbers amongst younger people in the population? So the very term narcissistic abuse comes from Alice Miller, who was a psychoanalyst who passed away in 2010s, The Drama of the Gifted Child. And that book is actually about a child's relationship with their parent, a child who's very intelligent, who's gifted, who may be incredibly emotionally perceptive and is trying to compensate for their parents' emotional deficits or difficulties. So Miss Miller came out or I should say Dr. Miller came out and said that she never intended for the link between this idea of narcissistic abuse and narcissistic personality disorder. So she actually disavowed that connection and said later that she did not want to stigmatize a clinical disorder. She was referring more to the idea of narcissistic traits or narcissism as a concept. So being selfish and being more interested in your own self and what matters to you versus the people around you. The term or the concept of narcissistic abuse, as she envisioned it, has very limited clinical research. And as a whole, if you do a search on narcissistic abuse at this time, there's very little peer-reviewed research. So it's something that has become popular in pop psychology language, but is not necessarily something that has a strong clinical conceptualization.
All right. So, Erin already talked a bit about IPV and domestic violence. So, if we're looking at aggression with partners, so we're looking at covert narcissism again. And that covert narcissism, remember, is where somebody's self-esteem might be hit harder. Sorry, we skipped ahead somehow. There we go. Somebody's self-esteem might be more impacted. It's going to be more of that amoral behavior. So it's looking like negative emotional states on behalf of the person who is the aggressor, kind of goes along with this covert narcissism. So when they aren't feeling too good, some unhappiness or whatnot, this could be a thing. And then that narcissists may actually be more shameful and full of rage when they're dealing with disappointment in a partner. So does that possibly strike the ego a little bit? There's that disappointment, they feel let down, and there's that revenge that comes out, and there could be that aggression in seeking revenge. It could be, might not necessarily be physical aggression, could be mental, emotional abuse, because I'm sure when we've heard that term narcissistic abuse, it doesn't necessarily have to be physical abuse. It could be that mental, emotional type abuse going on, psychological type abuse, which we'll go into some other things in just a minute too. But the traits of narcissistic personality disorder may exist in low levels in many people. So there again, we see that a lot of people could have these traits, and that narcissism itself might be on a normal distribution. We could be looking at a normally distributed characteristic there of people in society. And then when we go back and look at male violence, it could be a result of hypersensitivity to criticism. Thus, it threatens their ego. So a lot of things we're seeing with the males, they don't handle that criticism very well when we're looking at particularly this particular study, and then the ego kind of takes a hit in that sense. So we wanted to briefly touch on this dark triad. I don't know if a lot of you have heard about this. In the early 2000s, the dark triad became pretty well known. And malignant narcissism's link with that is definitely a thing that happens. So in case you're not familiar with the dark triad, there's three qualities, I guess you can say quality, or three traits associated, three personality characteristics. You've got narcissism, which we've talked about pretty extensively, Machiavellianism, which is that manipulation, looking out for oneself, and the lack of morality. You can probably see some tie-ins even with narcissism there. And also psychopathy, impulsive, antisocial behavior, and lack of empathy or remorse. So if we look at the big five again, remember I mentioned that earlier in regards to personality, each dark triad trait is associated with disagreeableness. So we talked about disagreeableness earlier. Well, all of these particular traits on this triad are associated with that. And there's this tendency towards dishonesty and immodesty. So it's kind of this lack of regard for other people and just not really feeling like they have to be very honest, which you probably see a lot in like some of the antisocial behavior and even with manipulation tactics. As far as the malignancy goes, there's those assertive tactics there, like intimidating, entitlement, and supplication with a partner. So, or anybody in particular, really this dark triad could go in any relationship. You could see these traits. There's a lot of research out there about, dark triad in the workplace or other places that this could come into play. So there are those tactics that are utilized that kind of bring in this dark side of narcissism. And it might be viewed, narcissism, I should say, might be viewed as actually one of the brighter concepts or traits of the dark triad, oddly enough. So if we have to look at the bright side, it's maybe viewed a little more friendly than Machiavellianism or psychopathy, because it's less about saving face and those justification tactics. Because think about it, with a narcissistic individual, they're already like, hey, I'm into this potential grandiosity and self-serving sort of mentality, and they're not really like hiding it as much. A second dark triad was found, which is characterized by this emotional vulnerability and an antagonistic interpersonal style. So with this secondary kind of dark triad, which we'd call the vulnerable dark triad, it's related to lower self-esteem. So in my mind, I'm looking at this as sort of the opposite of that malignant narcissism that we're seeing. And it's more of this vulnerable side. It's not so much of, I happen to have some antisocial tendencies, or I happen to, have this need to manipulate, but it's this low self-esteem that we're getting back to, and possibly some impulse control problems, as well as these kind of externalizing behaviors. Not really sure why they're acting out that way, why somebody's more aggressive. So again, this is maybe not what we typically think of what narcissism looks like. And it's more of that, like, I see it more of the covert side of things versus the overt, or I'm just a self-serving person, somebody might look at. So this is definitely something to consider. You're muted, Erin.
So abuse, what do we know to be the root causes, and how can we link that to NPD? What do we know so far? We know that there are multiple types of abusers. We know that there's conflicting data, so still not a lot of consensus. We know that premeditated abuse specifically is typically more associated with psychopathy. So somebody that is planning ahead and is giving a lot of forethought to punishing or controlling and hurting their partner is more likely to have psychopathic traits, often linked with child abuse. But again, that depends on the study. Other studies have said that there are people who abuse who had normal, quote unquote, childhood. So people that didn't necessarily experience or witness abuse throughout their childhoods. In some studies, narcissism and low self-control are linked to an increase in violence. So going back to what Dr. Littlebear had talked about, there is some potential for somebody who is very self-serving and who also has impulse control to resort to violence when someone else shakes up their image of themselves or what they believe to be, their situation. So somebody that presents a threat to their ego or how others might perceive them. Example might be, somebody that has cheated on them or who embarrassed them in front of other people. The legal system, unfortunately, has not treated DV and IPV the same way as other violence. So it is often not actually treated as a violent crime. It's not typically punished the same way that violence against a stranger or someone who is not in a relationship or does not live in the household would be. Unfortunately, abuse may also have its roots in pop culture. So there's a lot of normalization of controlling behaviors, of stalking, of lashing out when we're hurt, when we've been cheated on, when somebody insults us or embarrasses us. And that's kind of treated as part of the passion, or just that's what happens in relationships. And so with every generation, we unfortunately tend to normalize these behaviors. We know that there is possibly a link between witnessing abuse growing up for some people. And again, multiple types of abusers and abusive relationships. So it's not something that explains everyone's experience, but it seems to crop up in a lot of studies that people who have perpetrated abuse witnessed it growing up, experienced it growing up, and so that may be part of their normal. They don't know what a healthy functioning relationship looks like necessarily, so they're repeating these patterns because that's what they saw. And then lastly, unfortunately, pornography, which is now so readily available at all levels, including some really violent pornography, has been shown to have a link with violence against one's partner. So we know at the very least, aside from the potential personality disorder causes, there's definitely a societal part or portion to the DV or IPV picture. So we can't overlook everybody's collective responsibility and contribution generation after generation to domestic violence and intimate partner violence.
Right. So if we're looking at the clinical implications, like where do we go from here? Well, a lot of this stigmatizes people with narcissistic personality disorder. And, kind of like Erin was saying in the beginning, so and so is narcissistic, right? And as clinicians and educators, we have to be careful about using inappropriate language to describe persons with personality disorders or diagnoses, right? Not just to say like he's narcissistic. We could say this person has been diagnosed with narcissistic personality disorder, or maybe there might be some overt narcissistic traits going on with this person. Um, Maybe in a situation where we're working with a victim who is very, very upset, it's easy to want to label somebody, and we think of it like, well, they're not the good guy or good gal to this person right now, and that can definitely make things difficult as far as language goes. And then people who are in abusive relationships may get perplexed about, okay, what is this narcissistic abuse that I'm hearing about? I can't tell you how many postings I've seen from people about narcissists, narcissistic abuse, and they say, oh, that was my ex, that was my parent. So there's a lot of self-diagnosing and things going on that even clinicians aren't the only ones who discuss this idea of narcissism. And I know, explains away other reasons for domestic violence. I know, Erin, you've probably seen that in your practice, that this just kind of explains it away in another way. So
yeah, and unfortunately, as I said before, because there are different types of abusive relationships, different types of abusers, or abuser patterns, it's trying to say that, well, that must be narcissism, doesn't necessarily cover or explain what people are experiencing, and that can be really confusing. So maybe somebody has a partner who is really humble, generally really kind, but they have severe trauma, they have an alcohol or drug abuse disorder, and so when they're abusing substances, something sets them off, they fly into a rage, and they scream, curse, get violent, throw things. So somebody trying to understand their experience that keeps seeing narcissistic abuse, are they going to say, yes, my partner is perpetrating violence, what do we need to do to get them help? Or are they going to downplay it and say, well, my partner doesn't act like that, maybe they just get upset sometimes? So characterizing abuse as being always linked to narcissism could potentially turn people away from getting help, or could be really confusing as far as trying to contextualize their relationship. And then again, the language in and of itself can be really stigmatizing for people who actually have NPD. So we tend to, as a mental health community, move towards person first language. So we try to think and act very intentionally as far as how we describe people and their diagnoses. But that tends to go out the window with certain diagnoses that have a stigma related to them. So you may hear people refer to someone as a psychopath or a narcissist, rather than someone who suffers from psychopathy or who has narcissistic personality disorder. And that takes away their humanity, but it also takes away our drive to understand and to potentially find treatment or ways to help these people and to help their loved ones. So it's important for us to remember, even when somebody has committed grievous acts, that this is a person that we're talking about, and we want to understand so that we can prevent future abusive relationships. All in all, though, the conclusion is that this is just something that requires far, far more research than has been done thus far. And while it would be great to label everything under one umbrella, we're just not there yet. We don't have the
yeah, and like Erin saying, like, we don't have the capacity to treat a lot of people under one umbrella in itself, and it's hard enough to treat individuals who have narcissistic personality disorder. So if we want to say all of these people have these narcissistic tendencies, and these are the people who are the perpetrators, how do we treat them? Because we really don't have a good language for that. We don't have great training for that. So really what we need is further research. And when we talk about further research, we want to know more about, what do the counselors think? How are we talking as clinicians in the counseling setting? what are we discussing with with our clients, with other clinicians.
Perfect term.
Um,
One of the really important things to underscore right now is that unfortunately, there are not a lot of successful treatments for people who have perpetrated domestic violence or intimate partner violence. And you may have heard of batterers intervention programs. There's different labels for them. Batterers intervention program in and of itself contains kind of a problematic usage of language. But again, unfortunately, a lot of these programs aren't very successful. The survivors often report that their abuser has just learned to change tactics, or that they have gone back to just perpetrating abuse again, or that it stopped for a little while and then picked back up. And part of the issue is, again, we tend to try to use these one-size-fits-all approaches when really we need to have different approaches for different people, different situations, and putting everything under the narcissistic abuse umbrella is not going to help that.
Good. Yeah. And like we're saying about furthering your research, it's just really, the language used, counselor educators, how are we talking about this with the students we're teaching? What kind of research can we do to understand more in this field? Because there's so much research out there about narcissism, narcissistic personality disorder, the dark triad, that it can make you kind of scratch your head and say, where does all this fit in? So it is a challenge, but it's I think, and I know Erin agrees, it's a necessary challenge for us to take on and to try to understand better, because we know how things, when they start getting around in pop culture, it sometimes can be not the best. So we so appreciate you all watching our video, watching our presentation today. I believe Erin's email address should be available along with this presentation. And so if you have any questions, definitely reach out to her. Yeah, we enjoyed it and hope that you learned a little bit more about narcissism and abuse. Thank you all so much.